Greetings again, this is Dr. Bill Wyatt, and I want to go over a interesting scissor bite case that I did not do, but was done by a group of orthodontists and oral surgeons, and one of the men in the study club I had in class, and he brought me these pictures. And I disagree with the way they planned the treatment for this and how they did it. So I'm going to try to run over real quick. I'm not blaming them. They were taught that this is the way to do this type of case. So let's get going here pretty quick. I'll have to get this and I'll draw some on it. This is about as bad a scissor bite case as I've ever seen. All these teeth right in this area meet inside the mouth, and these meet on the teeth below. And these are good teeth right here that meet like that. And I'll show that on the x-ray here later. When we look at them, those teeth literally miss these other teeth. This is the worst scissor bite I've ever seen. Now I believe that if we line these teeth up and put pressure on it like we did on the case that you see, the other scissor bite case, that we could move these teeth buccally and bring them out, and they'd carry their bone structure with them rather than do it as these people felt like the way they were taught to do it. So they extracted these good teeth and they split the bone structure and put implants in, leading out like this, and then put the crowns on them at an angle, and had the lady, it looked nice, but it was the expense and everything of that is far more than I think would justify this type of treatment. And I'm going to show that to you. Now that's the other side of the mouth felt all right. Of course they put an implant in here to meet this, and they brought the tooth up and everything. That's all right. But they left these teeth and took the other teeth on the other side out to do this. Let me go. Now this is a real scissor bite. I don't think I've ever seen one quite that bad. And that's the x-ray now of this. These are, I'm sorry, this is the best I could get the pictures of. These teeth over here they kept, and they put an implant here, and they took these 3 teeth out, split the bone, put implants in this area right here to come out and meet these other teeth. And this is what I disagree with. I think they could have moved those teeth out slowly, and the teeth would have carried their bone structure with them. Now that's just my opinion. Now this is showing this young lady with the one side where they put the one implant, and here's where the teeth are out, and they've got the implants in those teeth, and they're going to bring them out to the side. That's a bad picture there. That's all I had to go on here. And the left side of the mouth is got the teeth lined up, and they put the implant here, and that's worked out all right. And let me go ahead and look at this again. This is the cephalometric x-ray. They corrected the overbite, the overjet, and all these other things. They did those things right. Now here is the case after these teeth were removed and we put the implants. Took the teeth out, put the implant. Teeth out, put the implant. They just put the implant in this area right here. And now they made these implants tilted out so that they could bring them in contact with the teeth up above. And so I disagree with this. I think that we could have moved those good teeth out there, and they would have brought their bone with them. Let's go ahead and check this again now. Let's get this thing going. There are the implants. Now there, you can see the implant there in the video picture. Now here it is after they finished. It looks nice. They've got the side over here. Here's the tooth. They put the implant in. And these are the 3 implants over here. On this side, I think that's wrong. There's 1, 2, 3, going back that way. It looks nice, and this would probably work fine with this young lady. It'll probably stay there. But I feel like this could have been done kind of like we did the case prior to this, where we put a big daddy arch wire in there and spread this out and use that elastic under here this way and pulling these over this way to pull those teeth over, and taking a little time, and we're going to move those teeth out there without extracting the good teeth to do this particular case. So there's the models of the teeth, and these are the ones where I think we'd had to move them a long way to get them out there. But I think that the bone structure, if you just took your time and put pressure on these teeth, put some buccal root torque in them, bring the roots out with them, you would have moved this whole bone structure out and brought it into contact. And that's my own opinion, and I don't have anything to prove that with, but this worked on that other case you saw. We moved these teeth. It looked like not a half inch, but quite a long way. And the bone was still a bone on those teeth. And that's what we've got here. That's the same thing. Now, the upper teeth that met those teeth wore into the side of these teeth. And so you would have had to open the bite some to bring the lower teeth to get them back out in this area here. So I feel like that would have worked, but I'm not telling them. I think they were taught that you cannot put teeth where there is no bone, but if you take a group of teeth and move them out, the bone structure goes with the teeth, and then the alveolar bone is where the teeth are, and the basal bone will shift to support the alveolar bone, and it takes a little time to do that. So I don't fuss at what they did, but I think it's wrong, and so I feel like it could have been done better, so I don't mind criticizing what was done here. So I thank you for watching. This is not a case that I did. This is a case that a friend of mine that I had in class was there, and he voted against this, but they went ahead and did. So they brought these teeth out by putting the implants and bringing them out like that, just putting the regular implant over here. Thank you for watching. I don't need to go through all these pictures with this, but we hope you understand this. And so if you happen to know somebody or doing this and they think that they cannot expand the teeth out here and get the teeth to go with the bone to go with the teeth, I've got oodles of cases where we've expanded the whole arch and the teeth carried the bone structure with them. So I'm going to hush in talking about it, but I think if you take a group of teeth and put pressure on them, and gradual pressure, that the bone structure will move with them. Now when you're moving them forward, you got to run a lip bumper there to run interference from them. On the side of the mouth, there's nothing, no pressure in there. You can bring them out without having lip bumper to run the interference for them. So let me see, I think this is the end of this case, and I will say goodbye, and I hope you'll get something out of this. If your teeth are in that shape, you can move teeth into areas where there is no bone, and I truly believe that, and we've done a lot of it. So I'm going to stop, and I'll close out with this.